Bismillahirrahmanirrahim. So I welcome you all to this video tutorial in which I will discuss the paracetamol toxicity. That is the one of the most and commonly used the non-steroidal anti-inflammatory drug. You must be aware that the paracetamol is the one of the commonly used and said that is the non-steroidal anti-inflammatory drugs. But there must be some precaution must be taken regarding the dosage of the paracetamols because if the dose of the paracetamol is increased, then the prescribed quantity or the quantity that is required for the human body to metabolize. So that will then further cause the toxicity of the liver, and that may cause the complete damage of the livers. So as you must hear, this is the structure of the livers. So the normal dose of the paracetamol is from the 500 to 1000 milligrams, and the 500 to 1000 milligrams. This is the dosage in which the paracetamols are available, but in the most common dosage form, its quantity is from the 500 milligrams. So the maximum quantity that we can take in is the 4 grams per day paracetamol. जो है इसमें सिंपल ये है कि डेली जो है हम 4 ग्राम जो है पैरास्टामोल ले सकते हैं। इससे अगर ज़्यादा हम लेंगे तो फिर ये पैरास्टामोल जो है लीवर टॉक्सिसिटी काज करेगी, एंड देन सम अदर डैमेज इट विल आल्सो काज। सो नाउ लेट्स प्रोसीड। सो नॉर्मली अगर हम जो है डिवाइड करें कि सपोज एक टेबलेट में जो कि मोस्ट ऑफ द डिफरेंट जो ब्रांड्स हैं अवेलेबल मार्केट में, इसमें जो है मोस्टली मेजॉरिटी ऑफ द ब्रांड्स में जो है पैरास्टामोल की डोजेज कितनी होती है 500 मिलीग्राम्स। एंड सपोज अगर हम इस बेसिस पर देखें कि द मैक्सिमम डोजेज दैट वी कैन टेक पर डे इज द 4 ग्राम्स। सो फिर इससे जो है एटलीस्ट 8 टेबलेट्स बनते हैं कि एटलीस्ट पैरास्टामोल की 8 टेबलेट्स है जो वो अलाउड है पर डे। अगर एक टेबलेट में जो है 500 मिलीग्राम्स पैरास्टामोल है। So now let's proceed that how the paracetamol cause the toxicity. And there is also another question that why we use the paracetamol. So actually the paracetamol is the drug that we mostly used, and it contribute to the class that is the NSAID, that is the non-steroidal anti-inflammatory drugs. And this is most commonly used for the different types of the indication, like for the pain and also for the antipyretic purposes, like to reduce the fever, and this can also be used as a so these are the different uses of the paracetamol के mainly जो है हम ये paracetamol जो ले रहे हैं जो body में different H's हो, फैन हो, उसके लिए, या suppose temperature body का rise हो, fever हो, so उस condition में mostly जो medication हम use कर रहे हैं even without prescription, that is the paracetamols, and it is available in different types of the brands. लेकिन मेजॉरिटी जो ब्रांड्स है इसमें पैरास्टामोल की जो डोज है वो 500 milligrams है. So now let's proceed that suppose if someone take the more than 8 tablets per day or more than 4 grams per day paracetamol, so what would happen to his livers, or and what toxicity this paracetamol will cause to the individual. So normally अगर हम paracetamol ले लें, so this paracetamol actually is metabolized within the livers, and in the livers you must know that every drug, majority of the drug is metabolized in the livers through two phases, and that will be either the phase ones in which the different further steps include, that is the oxidation, reduction, hydrolysis, etc. While in the phase two, there are the different conjugation reactions like the glucuronide conjugation, the glutathione conjugation, the sulfate conjugation, and also the different other acetylation or methylation. So these all are included in the phase two of the metabolisms. So when we take the paracetamols, that is non-steroidal anti-inflammatory drugs, so it is also metabolized by the phase two reaction of the metabolism processes in the liver. So there are different routes for the paracetamol metabolism. either the paracetamol will go through the conjugation reaction, and that conjugation will be the sulfate conjugation, and through the sulfate conjugation it will convert to the non-toxic metabolite, and then it will be excreted in the urine. And the next conjugation pathway is the glucuronide conjugation. Through the glucuronide metabolite, that is also non-toxic. And if the paracetamol moves toward the oxidation pathway, that is the phase 1 reactions. So through the oxidation by the cytochrome P450 enzyme system, that is the most widely used enzyme in majority of the drugs. So now, if the paracetamol move or goes through this pathway, so in the presence of the glutathione, this will be converted to the non-toxic metabolite, that is the mercapturic acid. But when the glutathione is absent and the paracetamol metabolism is through this pathway, that is the oxidation through the cytochrome P450 enzyme system, so it will convert to the intermediary metabolite. And if the glutathione, that is the antioxidant, and play a vital roles in the different in the elimination of the different free radical reactions. So if the glutathione is not present within the body, so this paracetamol will convert to the moieties, that is the N-acetyl benzoquinone amine, that is the metabolite that is responsible for the liver damage. So that is the N-acetyl benzoquinone amine. That is the metabolite that is responsible for the hepatic and then the renal damage. So, by the way, so this was the metabolism of the paracetamol, and we have already studied अगर पैरास्टामोल जो है वो इस पाथवे पर आ जाता है जिसमें जो है उसकी सल्फेट कंजुगेशन होती है, सो दिस विल कन्वर्ट दी, जो कि एक नॉन टॉक्सिक मेटाबोलाइट है, एंड देन ये जो है फिर यूरिन के थ्रू जो है किडनी के थ्रू यूरिन में जो है दिस विल बी एक्सक्रीटेड. While if this the paracetamol metabolize through the glucuronide conjugation, so that is also the non-toxic pathway, and this will also excreted through the urine. And but if the metabolism of the paracetamol is through the oxidation process, so if the glutathione is present, so that will also be the non-toxic metabolite will be found, and that will be excreted in the urine. But the major trouble here is if the glutathione is decreased in the body, or there is deficiency or the lack of the glutathione. So this paracetamol will metabolize to the toxic intermediate, that is the N-acetyl benzoquinone amine, and this is responsible then for the hepatic and renal damage. So now let's proceed. Actually, the toxicity of the paracetamol occur in three phases, especially in the phase 1 that occur within the 24 hours, and then the phase 2 that occur within the 24 to 48 hours, and then the phase 3 that occurs from after 3 to 5 days. So we will individually discuss the every phases of the this paracetamol metabolisms, and then if the glutathione is absent within the body, so through this intermediate metabolite, it can cause the liver, also or the renal or the kidney damage. So let's proceed to the next slide. So now in this slide, if we study that the paracetamol is actually the sign and symptom of the paracetamol toxicity start or occur in three phases, as I have already mentioned. The first phase that begins within the hours of overdose and consists of the some minor features like the nausea, vomitings, and failure of the skin, and also some sweating, that is the diaphoresis. However, the patient often have no specific symptoms or only mild symptom in the first 24 hours of the poisoning. So from this slide, we concluded that actually when someone taken the paracetamol more than 4 grams per day, so the sign of toxicity will appear within the 24 hour. And some of the clinical manifestation or sign of symptom of the patient will be the GIT problems like the nausea and vomitings, and also some other features like the pallor of the skin and also the sweatings. But this symptom may, in some individual, this symptom are also not present. This that individual may experience some mild or the moderate symptoms within the 24 hour of the paracetamol poisonings. So now let's proceed toward the second phase of the paracetamol poisoning or toxicity. So the second phase start from the 24 to the 72 hours, that is from day 1 to day 3, and followed by the overdose and consists of the increasing liver damage. So actually, the liver is damaged in the phase 2 of the paracetamol toxicity. In general, the paracetamol actually damage the hepatocytes, that is the liver cell that metabolize the paracetamol within the liver. The individual may experience different types of the features like the right upper quadrant trend during the phase 2 during the phase 2 toxicity of the paracetamol, and also there is increasing liver damage due to which some of the liver function test, that is the LFTs, will be alters and that will be abnormal from the normal range. And there is also some chance of the acute kidney failures may also occur during this phase. So from the this slide, we concluded that the within the phase 2 of the paracetamol toxicity, there may be the chances that the liver will be damaged, and also there is chance that the acute kidney failures may occur. And due to both of these, there may be some changes within the normal liver function test, that is the LFTs, that include the different like the AST and the ALT, or even the alkaline phosphatase, etc. So फिर जो different LFTs है, that will be abnormal, and that will show the paracetamol toxicity. Now let's proceed toward the phase 3 of the paracetamol toxicity. So actually, during this phase of the paracetamol toxicity, it start from the 3 to 5 days. और फिर इसके जो further जो complication है या जो sign symptom है इस phase की, that is the complication of massive hepatic necrosis. सिंपल मीन ये है कि यहाँ पर जो लीवर है ये पैरास्टामोल फर्दर जो है वो उसे डैमेज करता है और निक्रोसिस काज करता है, that is the sudden cell death, and then leading to hepatic failures. Simple mean the loss of the liver function. और जैसा कि आप सबको पता है कि लीवर्स का जो है इट्स प्ले अ मेजर रोल्स, क्योंकि लीवर जो है फिर डिफरेंट जो क्लॉटिंग फैक्टर्स है, अगर हम डिस्कस करें कि लीवर्स के फंक्शन क्या क्या है, सो लीवर जो है एट द स्टार्ट जो है डिफरेंट ड्रग्स को मेटाबोलाइज कर सकता है। इसके अलावा जो है ये एज अ डिटॉक्सिफिकेशन भी करता है लीवर, जिसमें जो है जो काफर सेल है दैट इज रिस्पांसिबल फॉर द डिटॉक्सिफिकेशन ऑफ द डिफरेंट केमिकल्स, and also the liver produces some different clotting factors that play roles within the normal coagulation process. And then there are different other chemicals that is produced by the liver, as the liver play a major roles within the human body. So there will be some complication during the third phase of the paracetamol toxicity, जो कि जिस तरह मैंने पहले बताया कि coagulation defect होगी, क्योंकि जो a lot of the clotting factors है, जो कि 13 फैक्टर्स है वो जो है लीवर सीक्रेट करता है। अगर लीवर जो है वो डैमेज हो जाए, सो फिर वो जो डिफरेंट क्लॉटिंग फैक्टर्स है दे विल बी नॉट सीक्रेटेड, एंड देयर विल बी दी सम प्रॉब्लम्स विद इन द नॉर्मल कोएगुलेशन प्रोसेस। फिर जो है हाइपोग्लाइसीमिया भी हो सकता है ड्यूरिंग द थर्ड फेज। इसके अलावा जो है द चांसेस ऑफ द किडनी फेलियर्स विल बी देयर, मीन जो नॉर्मल जीएफआर रेशियो है जो कि 120 ml पर मिनट्स है। फिर जो किडनी फेलियर्स में वो जो ये फार रेशो है फॉर इवन जो 20 ml 20% of the normal GFR से जो है वो डिक्रीज होगी, so that will be called as the kidney failures. And then इसमें जो है of course there will be the hepatic encephalopathy, mean there will be the liver damage. Also there may be the chances of the cerebral edema and even the sepsis, that is the chronic infection, they will be present within the blood circulation, and also the multi-organ failures, and eventually it will lead to the death of the individuals. So if the third phase is survived, The hepatic necrosis runs its course, and the liver and the kidney function typically return to the normal in a few weeks. इसमें सिंपल ये है कि अगर फर्स्ट ऑफ ऑल द फर्स्ट अप्रोच तो ये है कि अगर पेज वन में जिस तरह हमने डिस्कस किया कि माइनर सिम्टम्स होती है जो कि जीआईटी से रिलेटेड होती है लाइक दी नाजिया वोमिटिंग एंड दी स्वेटिंग और द फेलर्स वाइल जो कि फेज टू है इसमें फिर कम्प्लिकेशन अराइज होती है क्योंकि वहाँ पर जो हेपेटोसाइट्स है वो डैमेज होते हैं. So in the phase 2, there is some minor damage to the liver as well as to the kidney. While in the phase 2, there is the severe damage to the liver. और फिर उसमें जो है न सिर्फ लीवर को डैमेज होता है बल्कि डिफरेंट किडनी फेलियर्स भी हो सकता है इसमें इसमें फर्दर जो है सेप्सिस भी हो सकते हैं. इसके अलावा जो मल्टी ऑर्गन्स उसकी फेलियर्स भी हो सकती है एंड इवेंचुअली डेथ होता है. लेकिन इसमें ये है फिर कि अगर कोई बंदा जो है वो फेज 3 सर्वाइव करता है सो जो लीवर्स और जो किडनी का जो नॉर्मल फंक्शन है they will came back to its normal function after some weeks. The severity of paracetamol toxicity varies and it's depend on the dose. इस तरह मैंने पहले डिस्कस किया कि नॉर्मली जो है अगर एक टेबलेट है उसमें 500 मिलीग्राम पैरास्टामोल है सो वी कैन टेक द 8 टेबलेट ऑफ द पैरास्टामोल पर डे. इस तरह अगर हम डोज के हवाले से बात करें इसको 4 grams paracetamol is allowed to take during the 24-hour intervals. And so the paracetamol toxicity mainly depend on the dose. इस तरह जो है फिर and then whether the appropriate treatment is received by the patient or not. So these are the main factors that is responsible and then we will manage the patient according to their doses and also that whether the patient has received the initial treatment or not. Now let's proceed toward the treatment of the paracetamol toxicity. So in adults, the initial treatment of the paracetamol overdose is the gastrointestinal decontamination. So first of all, we will perform the gastric lavage, that is the washing of the GIT through the different irrigating solutions because paracetamol absorption occurs within the first 2 hours. इस तरह की यहाँ पर है कि paracetamol absorption from the gastrointestinal tract is completed within 2 hours after normal circumstances. So within that 2 hour हमें जो है GIT की जो decontamination है वो करनी चाहिए, gastric lavage होना चाहिए through different irrigating solutions. फिर इसमें ये है कि so decontamination is most helpful if performed within this time frame like the 24-hour. So now let's proceed toward the. So first of all, in the initial treatment of the paracetamol toxicity, हम जो पहले 2 घंटे हैं जिसमें paracetamol एब्जॉर्ब होता है from the GIT. So अगर हम उस वक्त जो है decontamination करें oral GIT की through different irrigating solutions or through any other ways. So through this approach, we can decrease the further toxicity of the paracetamol overdose. Now, what are the antidote for the paracetamol toxicity? जिस तरह के in the initial videos मैंने discuss किया है कि antidote जो है वो different ways से action show करता है and there are different types of the antidote. There may be either the physical antidote, the mechanical antidote, or the chemical antidote, or the physiological antidote. So अगर हम बात करें paracetamol के हवाले से जो कि antidote एक एजेंट होता है जो कि एक टॉक्सिन्स या एक पॉइजन जो है उसका जो एक्शन होता है वो रिवर्स बैक करता है और फिर ये एंटीडोट डिफरेंट वेज के थ्रू जो है अपना एक्शन परफॉर्म करता है. Either it decreases the absorption or it's deactivate the poisons or even it can antagonize the action of the pharmacological action of that poisons. So in the paracetamol cases, the acetylcysteine is the antidote for the paracetamol toxicity, or we can also refer this as the N-acetylcysteine, NAC. This is the antidote for the paracetamol toxicity. It actually works to reduce the paracetamol toxicity by replenishing the body stores of the antioxidant, that is the glutathione. So main action N-acetylcysteine का ये कि जो बॉडी में ऑलरेडी स्टोर ग्लूटाथायोन है, that is the antioxidant. So ये उसको जो है जो स्टोर्स ग्लूटाथायोन है उसे रिलीज करता है जिस तरह के हमने स्टार्ट में डिस्कस किया कि सपोज this is the liver एंड पैरास्टामोल की जो मेटाबॉलिज्म वो डिफरेंट वे से होती है। आइदर सल्फेट कंजुगेशन उसकी हो सकती है या ग्लूटाथायोन कंजुगेशन भी हो सकता है। लेकिन अगर ये फेज वन रिएक्शन में चला जाता है जो कि ऑक्सीडेशन के थ्रू होता है, जो कि डिफरेंट साइटोक्रोम P450 एंजाइम सिस्टम इसमें इन्वॉल्व होते हैं। अगर ग्लूटाथायोन deficient है बॉडी में, so this will form a toxic metabolite that is the NACQI that is responsible for the toxicity। लेकिन अगर हम जो बॉडी में स्टोर ग्लूटाथायोन है जो कि एंटीऑक्सीडेंट है, अगर हम उसे रिलीज करें थ्रू दी N-acetylcysteine जो कि एंटीडॉट है, so we can reduce the further toxicity of the paracetamol। So glutathione react with the toxic metabolite that is the N-acetyl benzoquinone amine metabolite, so that it doesn't damage cells and can safely excreted. So actually, from this video tutorial, we concluded that the paracetamol toxicity is actually a very sophisticated conditions, जिसमें जो है अगर हम नॉर्मल डिस्कस करें कि फर्स्ट ऑफ ऑल व्हाट इज द नॉर्मल डोज ऑफ द पैरास्टामोल्स, एंड सपोज अगर हम डिस्कस करें कि एक टेबलेट में 500 मिलीग्राम्स पैरास्टामोल्स है, सो 8 टेबलेट जो है वो अलाउड है फॉर 24 आवर। और अगर हम डोजेज की बात करें, सो 8 4 milligrams, sorry, the 4 grams paracetamol is allowed for 24 hour। लेकिन अगर पैरास्टामोल की क्वांटिटी इस डोजेज से ज़्यादा हो जाए तो फिर ये लीवर को डैमेज कर सकता है। और फिर लीवर को डैमेज करने के लिए इसके पास 3 डिफरेंट फेजेस में ये होता है। Either that will be the phase 1 जो कि 24 आवर में होता है, और the phase 2 जो कि 24 और 72 आवर के बीच में होता है। एंड फिर जो फेज 3 है जो कि 3 से 5 डेज में होता है। सो फर्स्ट अप्रोच हमारा तो ये होता है पैरास्टामोल टॉक्सिसिटी में कि हमने जिस तरह पहले डिस्कस किया कि आफ्टर द एडमिनिस्ट्रेशन एंड टू द बॉडी पैरास्टामोल जो है वो पहले 2 घंटे में वो एब्जॉर्ब होता है फ्रॉम द जीआईटी। सो अगर हम जो है एट द स्टार्ट उसकी जो एब्जॉर्प्शन है वो इनहिबिट करें थ्रू दी GI contamination or through the gastric lavage, so through this technique we can decrease the paracetamol toxicity। और फिर हमारे पास जो दूसरा ऑप्शन है वो ये होता है कि हम जो स्पेसिफिक एंटीडोट है पैरास्टामोल के लिए, दैट इज द एन एसिटाइल सिस्टीन, अगर हम वो दे एक पेशेंट्स को जो कि एन एसिटाइल सिस्टीन फिर जो है इसका मैकेनिज्म ऑफ एक्शन या किस तरह ये काम करता है। सो ये एक्चुअली जो बॉडी में स्टोर एंटीऑक्सीडेंट्स है दैट इज द ग्लूटाथायोन, ये उसको रिलीज करता है। और फिर जब ग्लूटाथायोन रिलीज होता है तो फिर जो टॉक्सिक मेटाबोलाइट बनता है दैट इज द एन एसिटाइल benzoquinone amine, so it will decrease the amount of this toxic metabolite because it will be then excreted in the urine। So through this different approaches, we can decrease the paracetamol toxicity। So this was all regarding the paracetamol toxicity। So thank you all for your times, and this was a slight touch toward the paracetamol toxicity। So अगर हम overview ले लें अपनी presentation की, so we have discussed first of all that what is normal dose of the paracetamols, then how the paracetamol is metabolized in the livers। तो फिर या तो ये फेज 1 के थ्रू मेटाबोलाइज हो सकता है या फेज 2 रिएक्शन के थ्रू। और फिर अगर बाद ही में जो है glutathione की deficiency हो, so they will form the toxic metabolite that is the N-acetylbenzoquinone amine that is responsible for the liver damage। और फिर लास्ट में हमने डिस्कस किया कि हम पेशेंट को किस तरह मैनेज करेंगे। सो विद इन 2 आवर जो है हमें GI की डिकंटामिनेशन करनी चाहिए, और फिर जो है N-acetylcysteine जो कि एक एंटीडोट है फॉर द पैरास्टामोल टॉक्सिसिटी हमें वो देना चाहिए। So this was all about the paracetamol toxicity from my side। Thank you all and stay blessed।